I'm diving into the world of Crohn's disease to uncover the shocking signs you might not know about, and I'm challenging myself to learn as much as I can in just 24 hours. Crohn's disease is one of the most debilitating chronic illnesses out there, affecting millions of people worldwide. It's an inflammatory bowel disease that can cause some pretty severe symptoms, from abdominal pain and diarrhea to fatigue and weight loss. But what's even more striking is that it's often misunderstood, and people suffering from it often feel isolated and stigmatized. Chronic illnesses like Crohn's disease can be really frustrating because they're not always visible to the outside world. You might look perfectly healthy on the outside, but on the inside, you're dealing with a lot of pain and discomfort. That's why it's so important to raise awareness about Crohn's disease and to educate people about its signs and symptoms. One of the main reasons I want to talk about Crohn's disease is because it's often misunderstood, even by medical professionals. Doctors might not always consider it as a possibility when diagnosing symptoms, and that can lead to misdiagnosis or delayed diagnosis. And that's exactly why we need to talk about it more, to break down the stigma and to encourage people to speak up about their experiences. Misconceptions about Crohn's disease are rampant, and they can be really damaging. Some people think it's just an excuse to get out of social events or that it's all in your head. But the truth is, Crohn's disease is a serious condition that requires serious treatment and care. People who suffer from it are not just being lazy or flaky, they're dealing with a real, physical condition that affects their daily lives. One of the biggest misconceptions is that Crohn's disease is the same as ulcerative colitis. While both are inflammatory bowel diseases, they have distinct differences. Crohn's disease can affect any part of the digestive tract, whereas ulcerative colitis only affects the colon. That's why it's so important to get an accurate diagnosis and to work with a healthcare team to develop a personalized treatment plan. Another misconception is that Crohn's disease is just about diarrhea and abdominal pain. But the truth is, it can cause a whole range of symptoms, from fatigue and weight loss to joint pain and skin rashes. And on top of that, people with Crohn's disease are at higher risk for other health complications, like osteoporosis, diabetes, and even colon cancer. It's not just about the physical symptoms, though. Crohn's disease can also take a huge toll on your mental health. Depression, anxiety, and feelings of isolation are all common among people with the condition. It's hard to deal with the uncertainty and unpredictability of Crohn's disease, and it can be really tough to maintain a sense of normalcy. The way people react to Crohn's disease can be really hurtful, too. Friends or family members might say things like, "Oh, you're just being dramatic," or "You're just having a bad day." But the truth is, living with Crohn's disease is a constant battle, and it's not something you can just snap out of. That's why it's so important to raise awareness and educate people about Crohn's disease. We need to create a culture where people feel comfortable speaking up about their experiences and seeking support. We need to break down the stigma and encourage people to be more understanding and empathetic. So, what are the signs and symptoms of Crohn's disease? Well, they can vary from person to person, but some common ones include diarrhea, abdominal pain, fatigue, weight loss, and loss of appetite. Some people might experience nausea, vomiting, or blood in their stool. Others might have skin rashes, joint pain, or eye problems. One of the most frustrating things about Crohn's disease is that the symptoms can be really unpredictable. You might have a flare-up one day and feel fine the next. Or, you might experience symptoms that seem totally unrelated to your digestive system, like skin rashes or joint pain. But what about the emotional symptoms? What about the anxiety, depression, and feelings of isolation that come with living with Crohn's disease? Those are just as important to acknowledge and address as the physical symptoms. I've heard so many stories from people with Crohn's disease who feel like they're constantly walking on eggshells, never knowing when their symptoms will flare up again. They might have to cancel plans at the last minute or avoid social events altogether because they're worried about having an accident in public. One of the most shocking signs of Crohn's disease is the way it can affect your relationships. People might start to distance themselves from you because they don't understand what you're going through. They might think you're flaky or unreliable, or that you're just looking for attention. Another shocking sign is the way it can impact your daily life. You might have to plan your entire day around your bathroom breaks or avoid certain foods because they trigger your symptoms. You might have to carry around an emergency kit with extra clothes and medication, just in case. But what about the lesser-known signs of Crohn's disease? Did you know that some people might experience oral symptoms, like mouth sores or inflamed gums? Or that they might have eye problems, like dry eyes or vision loss? One of the most surprising things I learned about Crohn's disease is that it can cause hair loss. Yeah, you heard that right, hair loss. It's not just about the digestive system, it can affect your entire body. Another lesser-known sign is the way it can impact your bones. People with Crohn's disease are at higher risk for osteoporosis, which can lead to brittle bones and fractures. Now that we've talked about the shocking signs of Crohn's disease, let's recap. Crohn's disease is a serious chronic illness that affects millions of people worldwide. It's characterized by symptoms like diarrhea, abdominal pain, fatigue, and weight loss, but it can also cause a range of emotional and psychological symptoms. Raising awareness about Crohn's disease is crucial, and it's something we can all do by being more understanding and empathetic towards people who suffer from it. Let's create a culture where people feel comfortable speaking up about their experiences and seeking support. Thanks for watching, and I hope you learned something new about Crohn's disease today. If you have Crohn's disease or know someone who does, please share your experiences in the comments below. Don't forget to subscribe for more health-related content, and check out my next video on digestive health topics.